Welcome. Thanks for watching this dairy video brought to you by DairyXnet. In this video, Dr. Christina Petersson-Wolfe joins us to discuss on-farm milk culturing. If you'd like alerts on new articles, videos, and resources, be sure to check out the video description below to follow us on Facebook and Twitter or sign up for our newsletter. And don't forget to subscribe to our channel here on YouTube. Today's presenter, Dr. Christina Petersson-Wolfe, is an associate professor of dairy science at Virginia Tech. She completed her BS at Penn State University, master's at the University of Guelph, and PhD at Ohio State University in 2006. Her research interests are focused around mastitis prevention, disease detection, and animal well-being. Currently, she has a heavy extension appointment where she works directly with stakeholders in the field while also maintaining an active research program.
Thank you. Today we are going to discuss the importance of on-farm milk culturing, and we are going to go through some of the techniques of how we on-farm culture, and then more importantly, what we do with these results once we get them. So why is on-farm culturing so important? It is most important because we want to be able to treat the right drug for the right bug. That is important, number one, because different bacteria respond differently to antibiotic treatments. Previously, we relied heavily upon antibiotic sensitivities to determine what type of drug to administer to a cow with clinical mastitis. However, research has shown that the use of antibiotic sensitivities is maybe not the best, because what we see happen in the gland is not necessarily what we see happen in the lab using an antibiotic sensitivity test. So we do know that culture-based therapy is the best option, and so because of that, we're going to go through some of the methodologies related to on-farm culturing. So the biggest question that I get asked when I talk about on-farm culturing is it going to be bad for the cow to wait 24 hours to treat? Because the idea is we notice a cow with clinical mastitis, we pull a sample, we culture that sample, we wait 24 hours to determine what's growing in that sample, and then determine our treatment based on that result. And so many producers want to know whether or not it's bad for the cow to wait that 24 hours. However, there have been several studies done to look at this specific question, and the results of those studies determined there to be no difference in long-term outcomes related to recurrence of mastitis, in terms of milk production, in terms of risk for culling of that animal, or the somatic cell score of that animal. And that was comparing animals that were treated immediately upon identification of clinical mastitis compared to those that waited 24 hours and were determined, treatment was determined based on culture outcome. These studies also showed that the use of on-farm culturing reduced antimicrobial usage by 50% just by waiting that 24-hour period and determining treatment. And we'll go through some of the reasons why that's the case later on in the presentation. They also found that there was no change in cure rates for animals that were treated immediately compared to those that waited 24 hours and treatment was determined based on culture results. So who should we culture? It really depends on the goals of the farm. Some producers will use on-farm culturing in a multitude of different ways. We say for certain that we should culture all clinical cases. That should be across the board. But then some producers are using this technique or this tool to determine the cause of high somatic cell count cows on their farm, to determine the infection status of cows that are going dry, using it to culture fresh cows to determine whether or not these animals are coming in clean after calving, maybe even using it as a tool to determine how well their dry cow therapy is working, if they're culturing cows at dry off and then again at freshening. And then also in heifers prior to calving to see whether or not there's an issue related to something like Staph aureus. So the use of this tool, although it seems obvious that we would use it during clinical mastitis, this tool can be used in a variety of different ways on the farm to really suit the needs of an individual producer. So you've got to think of it, take your blinders off and think of it more broad and with a broad scope as opposed to just thinking it in terms of clinical mastitis. But how we use the tool and the results and how we interpret the results are going to be the same no matter where you use it on the farm. There are a variety of different culture systems that are out there on the market. The one that I'm going to talk about today is the Minnesota biplate and triplate system. I would argue this is the most widely used system, and it's the one that I'm most familiar with. So it's the one that we're going to talk about today, but many other systems are available and would provide similar results, and the interpretation would be similar as well. So it's more important to find a system that works best for you and go with that system. The Minnesota system is produced by the University of Minnesota. The user guide is printed both in English and Spanish, which I find is very helpful, and we've used it, the Spanish translation guide, on many farms that I've worked with to get the buy-in and the education to the Spanish-speaking labor force. The initial input cost is low, and this is where I also find some hesitation with producers in adopting this technique. Many producers think, oh, I have to be a large farm to be able to use this system because it's expensive to get started. But that's not the case. Although you can buy an expensive incubator, you can also use a very inexpensive incubator. And the one I have shown here is called a Hovabator. It's actually an egg incubator. It costs about $55. It's available online. And so it's a very low cost input for the starting of an on-farm culture system. What producers that I've worked with have done is they've started with an incubator like this, and then if they find that they're really using it a lot or they're processing a lot more samples and they want an incubator that's a little bit more solid state, you certainly could purchase one down the road. But this is a inexpensive way of getting started. It is styrofoam, so it's not going to hold up to a lot of damage, but it is a good starting point. And then the cost of to run a sample is about $2 to $3 in supply costs, and that depends on whether or not you're using the biplate or the triplate. The use of the triplate, I feel, is best because of the additional results that you get in the addition of the third media. So essentially, the biplate has 2 different media types and the triplate has 3 different media types. They are selective in that they allow for specific types of bacteria to grow on each of the sections. And the addition of that third media does increase the cost of your supplies. However, the results that you get, in my opinion, are greater than the cost. So again, it's up to an individual farm as to which they want to use, but I would recommend the use of the triplate system, giving all 3 different selective medias. So the 3 medias that are available on the triplate system are factor agar. This is a proprietary agar that is produced by the University of Minnesota. I don't know what's in it, but I do know that it grows gram-positive bacteria only. So that would be things like Staph aureus or streptococci. The second agar is modified TKT agar. This is a media that will only allow the growth of streptococci. So essentially on the factor agar, you're going to have staphs and streps growing. On the modified TKT agar, you're going to have streps only growing. And then in the third section is McConkey agar, and this agar allows the growth of gram-negative bacteria only. So that would be bacteria like Klebsiella or E. coli, for example. In order to use the on-farm culture system, a sample is aseptically collected from the identified quarter, assuming that is a clinical quarter for the purpose of this slide. In order to collect a sample aseptically, you will use a cotton swab to clean the teat end really well. I usually press the cotton ball in half and clean on one side of the cotton ball and then flip the cotton ball over and clean the other side. And you will keep cleaning the teat end until the cotton ball looks clean. The next step is to squirt a few streaks of milk onto the ground and not collect those in the tube, and then collect the sample in the tube aseptically. Once the sample has been collected, you can purchase sterile cotton swabs from the University of Minnesota and you use a single cotton swab to streak on all 3 media types, dipping back into the sample in between each one. And we will go over the order of how to streak the media types in a moment. Once the medias have been streaked, the plate is incubated overnight or for approximately 18 to 24 hours, and growth can be observed at that point. And then treatment is determined based on growth. Some farms have been able to use a single plate for 2 samples, so they'll divide each of the 3 sections in half, and they can put 2 samples on a plate, and that is an option and will reduce the cost of supplies. This slide is to show a schematic of how the sample can be streaked, and so most importantly to remember on this slide is to streak the factor agar first, the modified TKT agar, which is the dark red agar, second, and the McConkey agar third. And the reason for this order is because there are selective ingredients in each of these medias, and so you're going from least selective media to most selective media, and that way when you're using the same cotton swab, you're not transferring any of these selective ingredients. You're not taking a more selective media type onto a lesser selective media type. After the 24-hour incubation period, growth can be observed on the media types, and essentially you're looking for a series of positive and negatives for each of the 3 sections of media, and then for the gram-negative section, the McConkey agar, you're also looking for a general amount of bacteria. So for the gram-positive growth, if there is gram-positive growth, we do recommend treatment in that situation. If the tri-plate system is being used, the results can determine whether or not the gram-positive growth is strep or staph bacteria. And if that is the case, the veterinarian can recommend how to treat them differently. For gram-negative growth, we're not only looking for the growth, but also a general amount. So if there are just a few colonies on the McConkey agar, the recommendation based on research is that you do not treat this animal with antibiotics. However, there's other situations where you'll look at the results of this particular media type, and there is a lawn of bacteria across this section of the plate, and that's a situation where that animal does need systemic treatment. Treatment options should be discussed with your local veterinarian, and they should recommend the treatments that work best for, or they feel work best for your individual farm. So again, to look at this a little bit more pictorially, if we have growth in the gram-positive section, as well as in the strep media, the modified TKT agar, we will make a conclusion that this is some sort of streptococci growing in that particular clinical mastitis sample. However, there's a situation where we may only see growth on the gram-positive side, and that's where we're suggesting that that might be a possible staph infection. The next question is, how do we identify Staph aureus? Many farms will pull out staph bacteria from the gram-positive quadrant, the factor agar, but then they want to be able to determine whether or not it's Staph aureus. And this photo to the right is taken from the user manual from the University of Minnesota, and it's showing not only growth but also the hemolysis, which you can see around the colony, and that hemolysis is indicative of Staph aureus. There is an additional test that can be done to confirm Staph aureus, and that's a coagulase test. That's also available from the University of Minnesota. So for producers that have a history of a Staph aureus problem, especially if they're culling animals based on Staph aureus identification, I suggest the use of an additional confirmation test to determine for sure that it is Staph aureus in that particular animal. This table is showing a breakdown of the results and what can be seen in the tri-plate system. And again, like I said, it's a series of positives and negatives, and that series of positives and negatives will be indicative of a particular type of bacteria. So if there's growth in the factor agar and the modified TKT agar, the suggestion would be it's possibly a strep infection or maybe even a mixed staph strep infection. But most of the time, especially in a clinical mastitis case, and if the sample has been collected well, it will more than likely be a single infection and probably a strep infection. Conversely, if there's growth only in the factor agar and not in the modified TKT or McConkey agar, then we will make the assumption that this is some staphylococci causing bacteria. And the hemolysis pattern can be checked to see whether or not it may be indicative of Staph aureus, and then a confirmation test can be done to check whether or not that is Staph aureus indeed. Growth in only the modified TKT section would suggest a streptococci infection. It's not as likely that you would have growth only in the modified TKT section and not in the factor agar, but it is possible. And then the last option for an aseptically collected sample would be no growth in factor agar or modified TKT, but that there is growth in the McConkey section. This would be indicative of some sort of gram-negative pathogen causing the clinical mastitis. Some examples are E. coli or Klebsiella. Serratia would be another option, as well as Enterobacter. And the list is quite long for your gram-negative infections, but that's the results that you would see for that type of infection. Sometimes, if a poor job of sampling has been done, you will see growth in multiple sections, if not all 3 sections, and that would give the indication that that sample was contaminated during collection. So one of the biggest questions and frustrations that I get when talking with producers is what to do with the no growths. They'll collect all these clinical mastitis samples and send them in, and they'll get a large proportion of their samples come back with no bacterial growth. And what does that mean? The results, or the literature tells us that 30 to 50% of all samples will result in no growth. So what does that mean? Well, sometimes the cow's immune system has handled it on their own, and so the bacteria are gone, but there are still signs of clinical mastitis because of the immune system that's handling the infection. Another option would be that the bacteria aren't currently shedding. So we know with a bacteria like Staph aureus that the shedding pattern is cyclic. And so sometimes we'll see bacteria upon culture and sometimes we don't. And it depends on where those bacteria are in their shedding cycle. That's more so the case with sampling high somatic cell count cows than it would be during clinical mastitis, but it is still an option during clinical mastitis as well. And then another option would be that you just simply didn't catch any of the bacteria. We're taking a rather small sample from these animals and we're plating an even smaller sample onto the media. So sometimes you don't catch the bacteria when you're plating it. If this particular animal cultures no growth upon a clinical sample being plated out, we recommend that animal be resampled if she comes back with clinical mastitis again. When we were talking about Staph aureus before, I mentioned that some farms will identify staphylococci, but if they have a history of Staph aureus, they really want to know whether or not it's Staph aureus as compared to coagulase negative staphylococci. The tri-plate alone doesn't give you that definitive answer. Like I said, you can look at hemolysis patterns, but as we mentioned before, the coagulase test would help to confirm whether or not it is Staph aureus. So a positive coagulase test is indicative of Staphylococcus aureus, whereas a negative test would be indicative of coagulase negative staph. The coagulase negative staphs are considered to be a minor pathogen, not a major pathogen like Staph aureus, and so they are treated differently, and your veterinarian can help to determine the appropriate treatment based on the results that you're seeing. So now I want to spend a little bit of time about the individual bacteria and their source, their control, and some possible treatment options based on recommendations from the vet school here at Virginia Tech. We talked about some of the differences between coagulase negative staph and Staph aureus in terms of identification, but their source is also different. Staph aureus is considered to be a contagious pathogen. It's passed from cow to cow at the time of milking, so milking time hygiene and is of utmost importance with Staph aureus. Treatment is an option in some situations. Sometimes we recommend that animal be culled if she is a chronic Staph aureus infection that you cannot get cleared. Whereas the coagulase negative staph and Staph hyacus are considered to be skin flora bacteria, they typically cause subclinical mastitis, although they certainly can cause clinical mastitis. It's just not as common as Staph aureus. Post-dip and the use of dry cow therapy are considered to be control mechanisms for these types of bacteria. If we move to the streptococci, we've got two different groups of streptococci, the environmental streptococci as well as Enterococcus. Enterococcus is not a type of streptococci, but they are similar in their nature to environmental streptococci. These bacteria are found in the environment, and the use of pre and post-dip as well as keeping a clean environment and dry cow therapy are all recommended control options. Strep disgalactiae is the control options for Strep disgalactiae are the same as the other streptococci and Enterococci. However, there is some thought that these bacteria may also be somewhat contagious and passed from cow to cow at the time of milking, as well as being present in the environment. There are lots of different coliform bacteria that can cause mastitis. These are all gram-negative bacteria. All coliforms are gram-negative bacteria, but not all gram-negative bacteria are coliforms. However, the coliforms are most likely to be causing clinical mastitis in dairy cows. So the options or the bacteria we have most commonly isolated here are E. coli, Klebsiella, Enterobacter, and Serratia. E. coli is most often found in the bedding, in the manure, and in the soil. Klebsiella is often associated with sawdust bedding or other organic bedding sources. Enterobacter is similar to E. coli in that it's found in bedding, manure, and soil. And Serratia is a soil pathogen that we see as well as a plant pathogen and also causes clinical mastitis that is difficult to cure. The use of a core antigen vaccine such as the J5 vaccine is a good option for reducing the severity of clinical coliform mastitis. It does not reduce the incidence of disease, just the severity. The use of inorganic bedding, such as sand, would be a good way of controlling coliform mastitis pathogens. Providing a clean and dry environment and the use of pre-dip is very important. And Serratia is a pathogen that is not killed by chlorhexidine dips. So if Serratia is a problem on a particular farm, we recommend the use of a pre and post disinfectant that is other than a chlorhexidine-based product. There are also a lot of other types of pathogens that do not fall into one of these three categories. We've lumped them together into the classification of other because they don't necessarily follow the rules of the staph, strep, or coliforms. Some of the other bacteria are listed here. We have C. bovis, yeast and molds, which obviously are not bacteria, Prototheca, which is an algae. Bacillus species can cause clinical mastitis, as well as Trupperella pyogenes, which was formerly known as A. pyogenes. C. bovis is commonly found in infected udders as well as the teat canal. The use of post-dip and dry cow therapy typically clears up these infections. Yeast and molds are common, particularly from dirty infusions. If the teat ends are not cleaned really well prior to infusing dry cow therapy or even lactating cow therapy, or a teat sealant. Some of the yeast and molds can be introduced into the gland. Scrubbing those Tdens well prior to infusion is recommended to control these. Most of these will spontaneously cure on their own. Prototheca, like I mentioned, that's a water pathogen. It's an algae. It is not a bacteria, therefore it does not respond well to antibiotics. It is considered to be contagious. The segregation and culling of these animals is important, as well as eliminating water access to these dairy cows. Bacillus species have been known to cause clinical mastitis. Again, this is probably coming from dirty infusions, using not scrubbing the Tdens well prior to infusion of lactating or dry cow products. T. pyogenes is known as summer mastitis in the UK. It is commonly from teat injuries or infections, as well as from fly bites. It is difficult to cure and get rid of. Fly control is highly recommended for the control of this particular pathogen. So the biggest question I get asked is how to treat these animals. Because I'm not a veterinarian, I can't recommend treatment per se. I have presented results here today from either research studies or from the recommendations that we have from working with the vet school here at Virginia Tech. However, it's really important to work with your local veterinarian to come up with the treatment options that work best on an individual operation. Coagulase negative staphylococci as well as Staph hyacus are the most easily treated. In general, the recommendation is to not treat subclinical infections unless the somatic cell count is really high. Dry cow therapy should clear up many of these infections, but the use of a broad spectrum antibiotic during lactation can be used if there are clinical cases of mastitis. Staph aureus is a different animal that it is much more difficult to treat. The earlier in lactation and the younger the animal, the more likely that animal will be to cure. An extended therapy treatment with perlomycin is recommended. Again, the treatment of second and third lactation animals, if it is their first offense, is the highest chance of curing these infections. Chronic infections typically become unresponsive to antibiotics, and we'll talk about why in a minute. Occasionally, you do get cured with dry cow therapy. The culling of chronic animals, when feasible, is recommended. I know this isn't always an option, and so some producers will segregate these animals into a separate pen to hopefully eliminate the spread to uninfected animals within the herd. And monitoring and culturing fresh cows and treating where applicable is a good way of controlling Staph aureus within a herd, because it is most likely to cure in that early lactation period. So this next slide is giving you a pictorial representation of why Staph aureus is difficult to cure. It's not necessarily that the antibiotic doesn't work against the bacteria, it's that the bacteria is really good at hiding from the antibiotic in the gland. So the bacteria are these little round dark circles within the mammary gland. You can see that they get up into the alveoli of the gland, and although the immune cells, these neutrophils, which you can see, are trying to identify and eat up these bacteria to control the infection, these bacteria are also really smart. And so many times what happens is they get into a pocket of alveoli and they will form scar tissue around themselves. And by forming this scar tissue, essentially they're forming a wall between them and the antibiotic. And so again, it's not that the antibiotic doesn't work against the bacteria, but when these bacteria have outsmarted the immune system and have walled themselves off in such a fashion that the antibiotics can't get to them, that's more likely where the lack of cure that we're seeing is coming from. If we switch gears now and talk about how to treat streptococci infections, the environmental streptococci and enterococci are a little bit more difficult to cure than your strep discalactiae. The suggestion is a broad spectrum antibiotic as well as dry cow therapy. The recommendation from the vet school here is that the environmental streptococci may be best treated with penicillin. Again, that's something that you need to work with your individual veterinarian to come up with the best option for your particular farm. And dry cow therapy does provide decent cure rates for environmental streptococci infections. Probably the most difficult to discuss or to cure are the coliform infections. There are many different ways to combat these infections, and if you were to ask multiple producers, you will probably get multiple different answers in how they handle these. So this is especially important to discuss with your local veterinarian to see what works best on your farm using historical data as well as their particular opinion. If the infection is local, the veterinarians here at the vet school recommend no intramammary treatment. Again, that would be a situation where we don't see many colonies on the auger plate, as well as not having additional signs such as fever, dehydration off feed, signs such as that. Supportive therapy is recommended if it's necessary. Many of these infections clear up with the use of no intramammary treatment within a relatively short period of time, and that is because the immune system handles these infections on their own. However, sometimes the infection and the bacterial load within the gland can overtake the immune system, and the immune system can't handle it on its own. And that's where we have the systemic infection, where other systems are included in the infection and other signs are observed, like fever, dehydration, off feed. IV fluids at that point are certainly recommended, followed by the use of some sort of NSAID like Banamine, as well as an IV antibiotic. Serratia bacteria are typically more difficult to treat. They cause a more chronic infection. Oftentimes they result in culling. The veterinarians at the vet school here have had some luck with the infusion of hypertonic saline into the gland, which disrupts the osmotic pressures within the gland that may help to eliminate serratia. However, that's something to work with your individual herd veterinarian to come up with an option that's best for you if serratia is present. The other classification of bacteria have a variety of different treatment options. C. bovis, like I mentioned earlier, does seem to clear up well with dry cow therapy. Lactating treatment isn't recommended at this point. Yeast and molds, as I mentioned before, do typically spontaneously cure on their own. Antibiotic treatment is not recommended because these are not bacteria, and therefore the antibiotics will not work. Similar to that is Prototheca. Because this is an algae, antibiotics will not work, and culling of these animals is recommended. I've worked with several farms that have bacillus infections in their particular herd, and these cause similar signs to a coliform infection. However, a broad spectrum antibiotic should clear these infections up. They don't always, but they should. And then lastly, T. pyogenes, the recommendation is to either kill the quarter or remove that animal from the herd, because these are also difficult to treat and can be passed from cow to cow. As a caveat to all of this, residues need to be considered when antibiotics are used. Making sure that we follow label directions for withholding of milk prior to shipping after antibiotic treatment is of utmost importance. And then testing for antibiotic residues where applicable is recommended. If you have further questions or want more information, please feel free to contact me. My email is milk@vt.edu, and my phone number is 540-231-4767. I'd be happy to help you either determine whether or not this system is best for your farm and or how to implement it, as well as to discuss results and how to determine course of treatment.